Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author, and host of the Natural Healing Show for UK Health Radio. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Now, our guest today is Lori Finlay. Lori Finlay is a nurse practitioner, clinical nurse specialist, coach, consultant, and speaker. And you can find out more about Lori Finlay and her wonderful work at her website, lorifinlay.com. Welcome, Lori Finlay.
Thank you so much. It's so great to be here. Thank you, Catherine, for this, wonderful opportunity.
Now, for our audience, we're going to be talking today about the misconceptions of women and heart disease. Okay. And so, Lori, will you start for our audience by giving us a brief summary of your professional experience of women and heart disease?
Thank you. I would love to do that. Yeah, I spent over 20 or 22 years in critical care cardiology. I mean, it's what I wanted to do when I was 10 years old. So I was really thrilled to be working in that environment. It was fast-paced, high-tech, amazing. I took care of the first heart transplant in Salt Lake City, Utah, and that was like a lifetime dream. And again, spent years in critical care cardiology. And through those years, it was fascinating for me to see the differences in how men and women were treated, and how women were often misdiagnosed, and how incredibly different the pre-op and intra-op and post-op experience, the whole experience, the rehabilitation experience was different for women. I started a big cardiac risk reduction clinic for prevention, right? Like to help people actually get on top of their risk factors and reduce the risk of a second event. It's called secondary prevention. My focus now is, of course, on primary prevention and teaching people the risks and how to stay healthy, particularly women, because there's still so many women that don't understand that this is still our biggest killer. So that is where my passion comes from. And again, it was because I saw so many inequalities through my years in medicine with women and heart disease.
Now, Lori Finlay, you also have some personal experience with heart disease. Will you share with our audience what has happened recently to you?
Yeah. Well, I'll share quickly just a bit of background. I mean, I have a big family history of coronary artery disease. My father died of a massive heart attack at the age of 61 when I was working as a cardiology nurse practitioner, lecturing all over the country how to reduce a heart attack, how to prevent a heart attack. It was devastating, to say the least. My grandfather, both, one grandfather had a stroke, the other one had an aortic aneurysm. It's all cardiovascular disease. And so I've known from a very, very young age to take care of my heart. And I had a very, very, very heart healthy diet. And I have been religious about that heart healthy diet and exercise and supplements and reducing inflammation, et cetera, for years. And just in the last couple of weeks, I underwent some minor sinus surgery. And as part of that, when they're doing significant work on the sinuses, they have to intubate you, right? Like literally put you under general anesthesia, put the tube down your throat so you don't drown in the middle of this procedure. So as part of that general anesthetic, pre-op work, or you need to get approved, right? Basically get cardiac clearance, get it chest x-ray and EKG and lab work done. And I went and had my EKG and I looked at it briefly. Now, this is the girl that has done thousands of EKGs through my career and read them one after treadmill after treadmill after treadmill, and briefly looked at my EKG, scanned it, and sent it off to the surgery prep nurse and said, "Isn't this beautiful?" And 3 or 4 days later, I got a message back, an email from the anesthesiologist that said, "You need to get cardiac clearance." And I said, "What? I've not had any cardiac symptoms." I said, "Are you kidding me? Like, I'm beating 30-year-olds on the Peloton. I'm healthy as a horse. What are you talking about?" And he comes back in the next email and says, check your precordial leads. And I'm like, oh, I did not even notice the flipped waves, right? Which are very indicative of a heart attack. And I was shocked and still in complete disbelief. Like, look, I haven't had any symptoms. This must be a false positive, right? And completely blowing it off. And and I still was obedient and scheduled my cardiac consultation, right, to get cardiac clearance, which meant an exercise treadmill, an echocardiogram, and all that stuff to get cleared for this minor sinus surgery. So I did all that. But in the meantime, I was with some dear friends and I said, I don't know. All I know is that I had a broken heart last year. You know, I went through a sudden, very abusive divorce process, right? I called it my 8-month divorce detour that was very, very abusive, and had 2 mediation sessions. The first was 13 hours long, and the second one was an 11-hour mediation that ended at midnight. And it was brutal, absolutely brutal. I was in such shock that I couldn't even cry. I couldn't even cry at the end of it. Not till the next morning when I woke up did the dam break and I finally started crying, right? But then I laid there and had this sharp shooting pain in my chest, more midline. It wasn't left, more midline. And I laid there like for 5 to 8 minutes and thought, am I having a heart attack? But I know the symptoms of heart disease and heart attacks for women backwards and forwards. And I went check through all of them, and everything else was negative. And it was fleeting. It was gone in 5 to 8 minutes. So I never thought another thing of it. And that was that. Went on. In fact, I had someone showing up to help me pack that day. Oh, the other thing, that morning, like we had gone through the Hurricane Ian, you know, the end of September, which wiped out or did major damage in Fort Myers, Florida. And I'm 2 hours north in St. Petersburg. But that particular morning, the morning after that horrible mediation, now a tropical storm, Nicole, was coming through. So all this was going on, right? And with that said, I felt fine. I got up, I started packing, all was well. Never had another symptom or never thought another thing of it until I got this EKG. And a week or so ago, I finally thought, I'm going to do some research. I mean, 22 years ago, there wasn't as much in the literature about the body keeps the score. But since Dr. van der Kolk's book, The Body Keeps the Score, has come out, I think there's been an expansive amount of literature. And there's now literature and research about broken heart syndrome.
Now, Lori Finlay, let me interject. So for our audience, and again, I think I really appreciate your courage in sharing your personal story, because here you are, a leading expert on women and heart disease. You yourself had a cardiac event, and at the time you wondered, but weren't sure. And it wasn't only until later that you did the lab test. And I share a story from my family history. Over a year ago, my brother called me at 7 a.m. on a Wednesday morning. And he said, Mom's had a heart attack. And, of course, me being me, it's like, because I'm up in Atlanta, my mom's in Savannah. So it's like, okay, should I come right down? Anyway, long story, my mother had a Takotsubo cardiomyopathy, but it was quite interesting because first the story was she had a heart attack, then she didn't have a heart attack, then she had a heart attack, then she didn't, then, it was back and forth, right?
Right.
And it was quite interesting. And even just saying that someone's had a heart attack it's a very alarming prognosis, whether you're a man or a woman, right?
Yes.
And my mother was quite sensitive about it.
Right.
So for our audience, because that's exactly what you had Takotsubo cardiomyopathy, and I'm totally butchering that. So for our audience, I'm going to read the name and spell it for you. Takotsubo cardiomyopathy, which is what Lori Finlay had. And my mother.
Well, no, I didn't have cardiomyopathy, right? So can I make a quick clarification here?
Sure.
So first, it was named this in the 90s. It was actually a Japanese, physician who discovered this. So
Okay,
what
and
happened?
I'm about to ask you, what is Takotsubo cardiomyopathy? So,
Exactly. And that's what I'm going to tell you, which is so amazing. So
Mhm.
typically a heart attack is caused by, a lack of oxygen to the cardiac tissue, right? And we think of it in our world as the coronary arteries are getting thicker and thicker and thicker and thicker. And you look down the coronary, the angiogram, and you see like blocked pipes, like plumbing, there's blocked pipes, and you have to go in with a balloon angioplasty or bypass around it or something like that. It's very, very different in this particular broken heart syndrome. And you cardiomyopathy, first of all, means that the heart muscle is not working well. It's not pumping strong enough. So you can still have this vasospasm or a spasm of the coronary arteries, which is characteristic of this phenomenon, this broken heart syndrome. So the stress, they in the literature says, divorce, death, grief, trauma, abuse, natural disasters, all of these things can cause the sudden rise of cortisol, which releases the epinephrine and norepinephrine, which then cause the coronary arteries to spasm, right? So that's why for me, the spasm only lasted 5 to 8 minutes. It was enough to change the electrical current or cause some damage in my heart to change the electrical current, right? That's how we can tell someone's had a heart attack, is the electrical current has now changed because of the tissue changes, right? So I could see on the EKG that I went through this really emotional experience, this unbelievable amount of stress and this emotional experience. For many, many people, particularly, women, and again, this is way more common in women, it is very short term, and you can heal from it quickly. Only 1% of the incidence is fatal. So people often, heal from this. And, as is evident for me in the last year, again, I'm competing and beating 30-year-olds on the Peloton. And
All
when I
right.
did my heart test, my heart was functioning and squeezing harder than, more effectively than most. So
Let's take this back for our audience who are trying to learn about this. Okay. So I'm going to ask you, just so you know what's coming, what are the typical symptoms of Takotsubo cardiomyopathy? And then I'm going to ask you, what are the symptoms of a typical heart attack? All right. So let's talk about our audience, what they can see in themselves or their loved ones.
right.
Right. So what are the symptoms of Takotsubo cardiomyopathy?
Well, again, some people can experience chest pain, right? Chest pain. Well, actually, let me go back a bit and start with what are the typical symptoms of a heart attack, because they're so different for men and women. We always hear of the elephant standing on the chest, right? That deep elephant chest pain that radiates to the neck and the left arm for men, right? For women, it can be very, very different. There may be no chest pain. They may just feel out of shape. They may feel lightheaded, nausea, sweating, maybe their stomach, they're sick to their stomach, so nausea, even some abdominal pain. They might get some discomfort in the neck or the right arm. So very, very different from men, right? And with the broken heart syndrome, it's more of, again, a shorter vasospasm. You can get the pain, but it may not last as long, and you may not have all of the other radiating symptoms that go with it.
Okay.
That's my understanding at this point, now that I've just barely jumped in and learning, about this syndrome.
All right. So we're talking about the misconceptions of women and heart disease.
Yes.
Let's take a break and listen to a message from one of our commercial sponsors here at UK Health Radio. We'll be right back.
Okay.
So, Lori Finlay, I so appreciate you sharing your over 20 years experience working with women in clinical settings in heart disease, and yet you yourself had Takotsubo a cardiac event, right?
Right.
So let's talk about our audience. So if a woman experiences these symptoms that you mentioned, when should they call for medical help? When, like my mother, when she had her symptoms, it was late at night and she was smart enough to call for an ambulance. So I'm happy to report
Right.
because she
Good.
got immediate care, right?
Right. Right.
So when do we call the medical professionals?
Okay, great question. First of all, I want to come back and clarify again between broken hearts. Yes, broken heart syndrome, the official name is a Takotsubo cardiomyopathy, but cardiomyopathy is when the heart muscle is barely functioning. Normal ejection fraction, the pumping or the ejection, the amount of blood that is ejected from the left ventricle out to the body. So that's what ejection fraction is. Normal ejection fraction is 55%. Fortunately, last week mine was 60. With that said, when people have less than 30%, we start to describe or identify them as having some cardiomyopathy, right? When it gets down to 10 and 15%, that's when people are typically put on a transplant list. So again, the word cardiomyopathy means that the heart is not pumping effectively. The heart is not pumping strong enough. So you could have this broken heart syndrome and that fleeting chest pain like I had without having cardiomyopathy. Okay. So with that said, for women, if they are experiencing some chest pain, some nausea, some vomiting, some lightheadedness, some anxiety, often it could be anxiety, some exhaustion, fatigue. There are so many things that just seem like flu-like symptoms, and literally flu-like symptoms can be one of the symptoms for women. But most definitely, if you're experiencing some chest pain and it's lasting more than 5 to 10 minutes, then it may be worth you going to get an EKG.
So should at
Going
that
to the ER
point
and get an
someone
EKG.
call the ambulance or wait, 6 weeks? Because often both in the UK and the US it can be a while before we can actually see a cardiologist.
Oh no, immediately go to the ER. I mean, waiting 6 weeks. And this is one of the challenges, particularly for women. And we'll go into more details about the signs, the presentation, the pathogenesis or the disease process, and why it's so different for men and women, and why heart disease is missed so often in women. Why they're blown off,
So
right?
Lori Finlay. So how does heart disease affect women differently? So what are some of the symptoms that are different in women than men?
Well, again, some of the symptoms are the lightheadedness, the fatigue, the sweating, the shortness of breath, the upset stomach, the nausea, right? It could be pain, slight pain and aching in the right arm instead of the left. Okay. It may not even be chest pain. It could just be fatigue. I feel like I'm exhausted and I've got flu-like symptoms. Whereas for men, it's typically the crushing pain in the left chest that goes over to the right arm, up the neck, into the back. So that's one thing there. But why women are missed so often and why there's so much confusion is because the disease process is so very different. And if you give me a minute, I'd love to share this analogy, which I think makes so much sense. First of all, if you think of how do most men gain weight, or where do men gain weight? Where do men gain weight, Catherine?
In their belly, yeah.
In their belly, in
Yeah.
one localized spot, like
Yeah.
a big pimple in their belly. And where do women gain weight?
All kinds of places. And my understanding is where we gain weight is dependent on our hormones. So, for example, when there's excess estrogen, you gain weight around your thighs. When there's too much cortisol, it's around your belly. When there's liver problems, it's above the belly. So it really is actually different based
Right.
on our hormones and what's going on with our health. But those are
Right.
some things. Or when we have low testosterone, then we have flabby tricep areas. So
Right.
it
But
really is, yeah.
what you're saying here is that women gain weight all over. And I mean, Any woman that's gained weight knows that her shoes might be tighter, right?
Mm.
Her bras might be tighter, or if she loses weight, all of a sudden she's losing it from her breast and her belly and her feet, like from head to toe, right? So with that, right, we'll say that men gain it very localized, like a pimple in the belly, and women have what we call diffuse disease. That's what it's called in the literature, diffuse, spread all over. So I'm going to use, for those that are watching on video, I'm holding up, those are not watching on video, you can, I'm holding up my hand
Mhm.
and forearm. And I'm using this as an example. If a man has coronary disease and has basically this big pimple that could be in the middle of the forearm between the wrist and the elbow, this big blockage. So on angiogram, you could look in and go, oh, there's that blockage. Let me bypass around that blockage or do a balloon and get through that blockage, right? That's localized pimple, if you will. For a woman, I'm holding up my 5 fingers. If we have diffuse small vessel disease, it's like the disease and blockages are all in my small fingers, so that all of the heart tissue that is fed by these coronary arteries is now at damage, right? So a man's might be here and you can fix it, but it's very, very hard to get in and do a treatment, not only diagnose, but do a treatment on these small vessels, right? So prevention is very, very critical for women. And with that said, because our disease process or the pathophysiology is so different, it also makes diagnosing so much more challenging for women. A regular coronary angiogram or a regular exercise treadmill test may not pick up the diffuse disease that women have. Like they could go and say, I feel terrible. I feel this way all the time. I'm short of breath on exercise. I feel fatigued. I feel so out of shape. And they could do an exercise treadmill or an angiogram and say, you're fine. But for women, we may need an MRI, like more advanced technologies to detect the diffuse disease that's spread all over in the smaller coronary arteries for women.
That's great information. So what you're saying, Lori Finlay, is that if a woman has some of these symptoms, you're actually recommending that they push farther and ask for an MRI. Is that right?
Yes, absolutely. Yeah. You know,
So, mhm.
there's still a significant, unfortunately, a significant misconception, not just for women, but for the medical world as well. I mean, women still, I mean, you know, women are more concerned about their breast health and about breast cancer, and they still don't think that coronary disease is their issue. It's not just in the United States, here in the UK as well. 3.6 million women in the UK are living with heart disease. And the British Heart Foundation has said that, you know, coronary disease, of course, kills twice as many women as breast cancer. And they say 98 women a day, or 4 every hour, are having a heart attack in the UK. I mean, that's startling. In the United States, and I would not be surprised that it's almost identical statistics in the UK and all of Europe, that while maybe 50% of women know that heart disease is, you know, an issue, only 13% think it might be their issue or might be their number one killer. So there's, you know, misconceptions and denial all the way around. And it just gets, unfortunately, fostered in the literature and starts with even clinical trials, the biases that are going on with women.
So Lori Finlay, so from, again, going back, I talked about my mother having Takotsubo cardiomyopathy.
Right.
Practice saying that. And so for myself, personal history, my grandfather died age 61 of heart disease, and he was a medical doctor back in his day, and he had open heart surgery back in his day. And then my grandmother died age 65 of heart disease. They
Right.
were both smokers back in the day. So recently I had, because you mentioned you feel that MRIs are helpful for women. I had a CT scan of my heart. I had, and I'm just talking for our audience so we know what sort of test to ask for. So I went to the cardiologist, talked about my family history, and I got a CT scan. And that took about an hour. It was really fascinating. And then the person reading the test said, you're completely fine. Also,
Right.
we could get a calcium score of our heart and, looking for blockages. So these are all medical tests that if you have some of the symptoms that Lori Finlay is talking about, you can ask your medical professionals for, right?
Yes.
Because it's so often overlooked.
Right.
So
And
Lori,
those tests are very, very, very helpful. There's a few other tests, and we can talk more about that later, but there's a few other tests. Um, I know here in the States, we can get one called the pulse test, PULS, like the pulse, checking your pulse without an E. And it's very, very sensitive and specific inflammatory markers that can predict your risk of a coronary event in the next 5 years. If you don't have access to that, you can do blood tests for inflammatory markers like CRP or C-reactive protein and IL-6. You can also check, your lipoprotein little a. For years, we felt, oh, everybody needed to know their cholesterol. We now know, and we've known for 15 or 20 years, that cholesterol is not the problem. It's inflammation that causes the heart attack. It's inflammation that causes the sudden cardiac death and the rupture of these vulnerable plaques. So, statin drugs are all over the world, but lowering your cholesterol is not as important as lowering your inflammatory scores. And you can measure some of that with blood tests as well.
great information. So it's not so much cholesterol, but it's our inflammatory markers.
Yes,
And
absolutely.
so with that, let's take another break and listen to another message from one of our commercial sponsors here at UK Health Radio. And we'll be right back talking about misconceptions of women and heart disease. I'm Catherine Carrigan, medical intuitive healer, and we're talking today to Lori Finlay, nurse practitioner. So Lori Finlay, another example that I can have from my personal experience, one of my clients was sitting at her computer and started to feel weird. And she was smart enough and in tune with her body enough she actually drove herself to the hospital in the middle
Right.
of the night. and and she was put on a pacemaker. So we're talking also about what we can do, and you and I are both prevention minded. So what are some of the common things that women can do to prevent heart disease?
Well, first of all, take care of their diet, right? Make sure they're on an inflammatory diet, an anti-inflammatory diet. Make sure they cut out the sugar, cut out the trans fats, the hydrogenated fats. Those all cause serious inflammation. Start having real, raw, organic fruits and vegetables that have a lot of antioxidants in them. Those are some of the most important things that they can do, right? Limit the toxins that they're exposed to. Environmental toxins are significant and cause a tremendous amount of inflammation. Believe it or not, even well, poor relationships can cause a lot of stress. Reducing the toxicity in your life, not just environmentally, but relationally as well. Getting rid of the stress in our lives, making sure that we're moving. Movement is critical for supporting our heart health. Balancing your hormones is very, very critical in supporting heart health, because when we start dealing with estrogen dominance and hormonal imbalance, it causes weight gain and diabetes and hypertension, and all of those are significant risk factors for coronary disease. So those are the things that you should work on. Other things that women may never even think of: limiting your exposure to Wi-Fi. And people are like, what? Like Wi-Fi, like 5G, like your cell phone and your computers. If you can at home, make sure that you've got an Ethernet, that you're not relying upon Wi-Fi, or turn off the Wi-Fi at nighttime. And for heaven's sakes, do not wear your cell phone on your body unless it's in airplane mode. What that does to your body and inflammatory numbers, it just skyrockets. And so those are little things that you can do to reduce inflammation. Making sure that you heal your body or detox and cleanse your body of heavy metals and mold and mycotoxins. All those things can increase your risk of coronary disease. Making sure that you get optimized glutathione levels. And I'll talk more about that and the source for that as well at the end. Making sure that you reduce oxidative stress. And as we've talked about, the Wi-Fi and the heavy metals and the mycotoxins, all those can reduce oxidative stress. I mean, little things like don't stand in front of the microwave. In fact, I won't eat microwaved food, but I also will not be in a room where there's a microwave. Like the amount of damage and oxidative damage and stress that's caused by Wi-Fi and all of this radio signals that we're dealing with in our modern world is just intense. So you can get rid of those, limit those. And certainly if you're a smoker, oh my goodness, stop the smoking, because you're just literally killing yourself and dramatically raising your risk. Another important thing for women is to make sure that they balance their blood sugar. Like if you've got abdominal fat, right? They call it visceral adiposity. If you've got weight around the belly, your risk of coronary disease skyrockets. And for women that have diabetes, their risk of heart disease is 3.7-fold higher than a man with diabetes. So it's very important for women to keep that in mind and I need to trim down. I need to do what I need to do to trim down. I think other things that women need to do to help prevent, right, is to make sure that they're in social circles. Loneliness and depression are huge risks for coronary disease for women. Well, for men as well. And, women often put their needs very, very last. In fact, the research over in the UK shows that women wait 37 minutes longer than most men to head to the hospital if they've got chest pain. And that equals a significant amount of increased risk of damage. When someone comes, if they are indeed in the middle of a heart attack, we've got anywhere from 1 to 4 hours to administer the clot busting drugs to bust that clot that is restricting the flow of oxygen and reduce the damage to the heart muscle, to the myocardium. And the longer we wait, right, the longer the challenge is to preserve that heart muscle. And again, because women, and this is another reason that women put it off, and or when they go to the ER, why they're even misdiagnosed or just completely stepped over, is because we're used to a high pain tolerance. Women, if you've had really rotten menstrual symptoms and incredible pain and cramping, and you've been used to that your whole life, and you've dealt with labor and delivery, and women are used to high tolerance of pain, right? I literally, for years, have experienced this, right? When teaching either in the critical care or teaching ER nurses, the women would come in and they'd be laying over in the corner on a gurney saying, I don't feel good. And some man's over here screaming bloody murder. And he just has, epigastric, he's just got some heartburn. They give him a little cocktail with some Pepto-Bismol and his pain goes away because it's just heartburn. And they finally do an EKG on a woman a couple hours later, and she's in a full-blown heart attack, but she's been sitting there quiet as can be, right? So again, we need to keep those things in mind.
So Lori Finlay, this goes back to what we were talking about when women notice these symptoms, and you said that women wait 37 minutes longer on average to call for help than men. So, and you only have 1 to 4 hours window to get the help that you need. So we really need to reach out for help as soon as possible.
As soon as possible. And also make sure that you've got a patient advocate. I mean, I'm so thrilled that you are sharing this information with your listeners so that they can become their own advocates if they do experience some kind of chest pain. And once you get to treatment, right, again, there's disparity all along the treatment from initial diagnosis to diagnose, for initial entry, right, to the ER, to diagnosis, to intervention, to follow up. Women are not getting as aggressive treatment. They're not getting angiograms. They're not getting bypasses. They're not they're not getting the treatments they need. They're not getting referred to a cardiologist. They're not getting referred to cardiac rehab. Can I share a story real quick of one of my most early examples of a young 40-year-old woman?
Sure. But let's go back, because we're wanting to give more helpful information for our audience about what they can do. So
Okay.
for myself, in this day and age, there's all kinds of monitors that you can wear on your body that talk about how you're doing. Now, I myself wear a Whoop. It looks like a watch band. And one of
Right.
the things that it monitors is that it monitors heart rate variability. And that's just one indicator of how
Right.
well the heart is doing. Lori Finlay, what is heart rate variability, and how does monitoring our heart rate variability help our heart health?
Well, that's a great question. I love HRV and heart rate variability, and there's some excellent tools out there. I happen to wear an Aura ring at nighttime. Now, with that said, I wear that Aura ring because I can turn it off so I don't have Bluetooth, going through my body on that ring all night long, but it measures your sleep and your HRV. And then in the morning, I use a device by a company called Elite HRV, which, put the finger probe on and it measures my HRV in the morning. So HRV stands for heart rate variability. And it's the difference between the heart rate, the variability between your heartbeats, right? Like your heartbeats are not exactly like this. It could be this long and then this short and this long and this short. So that's the heart rate variability. And heart rate variability is an indicator of your autonomic nervous system. It's an indicator of your sympathetic, your survival nervous system. Some people call it fight or flight. I call it your survival nervous system, your SNS or sympathetic nervous system, as compared to your parasympathetic nervous system, which I call your pretty safe nervous system, right? When you feel pretty safe, right? Your stress hormones are down, your body is calm, your blood pressure is calm, your heart rate is calm. Those stress hormones are much are low, right? So if you track your HRV on a regular basis, you can see how well you are dealing with stress on a daily basis. I can tell you, right? We talked a little bit about relationships and relational stress. 2 weeks after my divorce was finalized, like everything, all the finances and everything, my heart rate variability went up 13 points. That's profound. And it's been that high ever since, which was, it's an indicator of the amount of emotional stress that I was under,
And
right?
my understanding with heart rate variability is that the higher the number it is
The better.
the better, right?
Yes, the higher the better.
So,
Exactly.
so what sort of factors, what sort of lifestyle factors adversely affect our heart rate variability, cause that heart rate variability to go down?
Well, one of them is a terrible diet. If you've got sugar, if you've got alcohol, like you can literally trace it.
Mhm.
Like, if you've got something to measure your heart rate variability, have yourself a glass of wine or alcohol and
Mhm.
watch your heart rate variability plummet for 3 to 4 hours. Have a big sugar-laden meal and watch your heart rate variability plummet. Have, late night with sleep deprivation and only get 4 or 5 hours of sleep and watch your heart rate variability plummet. No exercise for several days, watch your heart rate variability plummet. So all kinds of everyday things, and again, if you were to expose yourself to a lot of Wi-Fi and stressors, you could see that your heart rate variability drops as well. In fact, this is another one that's shocking. We sit at our computers all day long, and we know that sleep apnea is a bad thing, right? And it'll drop your heart rate variability. But they now call sitting at they've now noticed a syndrome basically of us sitting at our computers all day, and they call it desktop apnea, right? Where we're just focused on the screen and we're kind of, blitzed out and we're not breathing, and our heart rate variability can drop. So I've got a little device on my computer. It's actually to save my eyes. It's a software, called Iris, and it just comes on every 15 minutes and grays the screen and reminds me to close my eyes. And initially it was an irritant. It was like, how can I skip this? Till it finally dawned on me, if I actually close my eyes and breathe deep breaths for 15 seconds, like that'll raise my heart rate variability. So I now use it not just as a prompt to help my eyes, but also raise my HRV. So there's little trips that you can do, little tricks.
So one of the things we know is that people's heart rate variability tends to decrease as we age.
Yes.
And again, this is a marker. It's a general marker that anyone can monitor of your overall, not just nervous system balance, but also your heart health. So what can we do to improve our heart rate variability?
One of the best things that we can do is regular breathing exercises, meditation and regular breathing exercises throughout the day. That will help raise our HRV.
Fantastic. Now you mentioned glutathione. What is glutathione and why is it important for our heart health?
Great question. First of all, glutathione is the longevity molecule that God put inside of every single cell in our body. It is the master antioxidant, the master cell detoxifier, the master immune booster, and the master anti-inflammatory. So when we think about the risk factors for coronary disease, we want to reduce inflammation, reduce oxidative stress, get rid of those antioxidants, right? Then having a low glutathione makes you at high risk for coronary disease. Now, glutathione drops about 10% every decade after the age of 20 if you lived in a perfect environment. If you lived in a bubble with perfect food and no sleep deprivation and no stress and no Wi-Fi, it's still going to drop 10% a decade. But how steep and fast it drops, in other words, how much stress you put on your body. Are you a smoker? Are you a drinker? Are you staying up late and getting terrible sleep? Are you an extreme athlete, right? Do you have a terrible diet? All of those things can make glutathione drop faster and steeper. And there's an inverse relationship between how fast and steep glutathione drops to how fast and steep you get the diseases of aging, i.e., right, coronary disease, cancers, Alzheimer. It could just be, I can't keep up at the gym. That's an early sign. It could just be, I can't think very well at 3:00 in the afternoon. I hit a slump. Those are early signs of, glutathione deficiency. My knees ache. Those are early signs, right? My memory isn't as sharp. But again, the diseases of aging are accelerated dramatically by low glutathione. And when you improve glutathione levels, particularly if you use the product that I've used for 15 or 20 years, well, for about 18 years, is a product that creates endogenous glutathione. So
And what is
instead,
that product? Because I know some people get IV injections, but
right,
many of our audience may not be able to afford hundreds of
afford that. Right. Well,
right
and the scripts are
outside the
different.
right.
Right. So, like when you go to the movie theater, it'll say exit. Exit means outside, right? EX, outside. So exogenous glutathione, exogenous, anything means it's made outside of the body in a laboratory. Glutathione is a really, really big molecule with 3 tripeptides, glutamate, lysine, and cysteine, right? Glycine, glutamate, and cysteine. Well, cysteine is what they call the rate limiting factor because cysteine gets destroyed in the gut. So it took 25 years and 9 PhDs to find a way to protect the cysteine, that amino acid, so we could take it orally, right? with the other two amino acids to go intracellular and make glutathione ourselves. So we're now giving our body, our cells, the proper nutrition to make intracellular glutathione, and it works much faster.
So simply put, and we understand it's hard for your body to get glutathione, what are some simple ways that people can increase their glutathione?
Well, they can certainly increase their amount of cruciferous vegetables.
So that's
Uh, broccoli, Brussels sprouts, kale,
cauliflower.
cauliflower.
Yeah.
But if you cook them too much, it kills all of the beneficial compounds, ingredients, right, in those. And with that said, I mean, even whey protein, you could have lots of whey protein, but it's only going to raise your glutathione about 20%. The particular product that I'm recommending is
And
called
what is the, go ahead.
the name of the product is Cellgevity. Cell, Gevity, like longevity, Cellgevity, made by a company called Max International. They should be able to ship to England in the next 4 weeks. They just had a name change, but they can ship to England. And I'll put a link in the show notes, right, with some information. But again, the advantage is, instead of taking something that was made in a lab and then, it's a big molecule, it's got to be broken down inside the body, requiring cellular energy to break it down, then try and get intracellular, and now requiring cellular energy to create the glutathione. That's a lot of work, a lot of cellular energy required. Whereas if you have something that's an endogenous supply, it goes straight intracellular and can raise glutathione up to 300%. And there's been all kinds of clinical studies that have shown that.
So Lori Finlay, nurse practitioner, you've had professional and personal experience with heart disease. Any final thoughts for our audience?
Well, I think, yes, I want women to understand that it is really, really, really important to balance their hormones. Hormone health is critical. Estrogen dominance is a big risk for coronary disease. And in fact, you can send women to my website. There's a free quiz there that they can take to see if they do have estrogen dominance, which is one of the most significant risk factors for not just coronary disease, but also for breast cancer. So there's a free quiz there. But hormone balance is really important. And, through the years, unfortunately, when the Women's Health Initiative study came out in 2002, they said hormone replacement therapy was terrible, and it caused 29% more heart attacks and 36% more strokes and 113%, blood clots. Don't get hormone therapy. Well, they didn't let the women know, or the public know, or even many physicians understand that they were using synthetic hormones. It's the synthetic hormones that are causing the problems. Bioidentical hormone therapy, on the other hand, is very beneficial to the heart. And I would recommend women that are menopausal women to get on hormone replacement therapy for at least 5 to 8 years, because it's very heart protective and very protective for the cardiovasculature from head to toe. So preventing decline, cognitive decline and Alzheimer's. And so that's one of the things I would end with as well, is balance your hormones. There's phenomenal testing in the world. I use the Dutch test, which is the most advanced hormone test in the world. And you can find out more information on my blog, on my website. And there's incredible resources for women if they start doing a little bit of research. And my website is loaded with information.
You've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Our guest today has been nurse practitioner Lori Finlay, generously sharing her personal and professional knowledge about women and heart disease. And remember, if you are a woman and you experience some of the symptoms we've been talking about, realize that you've got a 1 to 4 window to get the help that you need, and do not hesitate to call for help. Thanks so much for listening, and we'll see you next time.